Yeah. KonnectMD. Not insurance. It's a lifestyle. Talk to 'em. Yeah. KonnectMD, yeah, we tapped in. Healthcare membership, we locked in. Not insurance, don't get it twisted. 24/7 dot when you need assistance. Travel discounts, yeah, we gon' slide. Lifestyle club, keep your peace inside. Free mental health, that's real love. We level up, whole life, not just one plug. I was tired of the bills, tired of the wait. Be sitting in the lobby, stressing on my day. Now it's one membership, simple, straight. Phone in my hand, I'm good, feel safe. Late night questions, I don't panic. Tap in quick, get guidance, no frantic. Boss moves only, I'm on my grind. Protecting my health and my peace of mind. This that lifestyle, this that upgrade. Not that maybe coverage, now we get paid. Save on trips, take flights, new scenes. From the city to the islands, live dreams. And my mental, yeah, we keep that strong. Free support when the pressure too long. We don't play with the stress, we address that. KonnectMD, put your life on the best track. Yeah. KonnectMD, yeah, we tapped in. Healthcare membership, we locked in. Not insurance, don't get it twisted. 24/7 doc when you need assistance. Travel discounts, yeah, we gon' slide. Lifestyle club, keep your peace inside. Free mental health, that's real love. We level up, whole life, not just one plug. Tell them it's a club, not a policy. Real ones, no value, that's quality. For the self-made, for the 9 to 5. For the ones tryna heal and still survive. If you got goals, you need your health right. If you got dreams, you need your head right. We talk wellness, we talk progress. More life, less stress, that's the message. So tap in now, don't wait on later. KonnectMD, whole life ever later. Lifestyle wins, that's the plan. Membership way, bring your fam. KonnectMD, not insurance, the excess is like. Let's go. KonnectMD. Lifestyle club, not insurance. It's access, it's savings, it's peace. Let's go. Let's go.
Hello world, how you guys doing? Listen guys, my name is Dr. Casual Pitts and I am the VP of Sales and Business Development for this amazing company, KonnectMD, which you are about to hear today. I want to thank you guys for tuning in, joining us on today. I'm excited. I hope that you're excited. So guys, without further ado, let's get into this amazing presentation. Now, this is going to be an interactive session. So if I talk to you, all I ask you to do is talk back to me. But guys, I'll only have 5 questions for you on today. And the very first question is, how many of you believe that healthcare costs are too high right now? If you do, put a yes in the comment section. And if you don't, go ahead and put a no. However, for this particular illustration on today, I'm definitely typing yes.
This year, healthcare premiums have rose over 114%. And overall spending, national health expenditure growth, is projected to average 5.8% annually through 2033. This means employers, Medicare, and Medicare will also be affected.
Guys, listen, since January 1st of this year, premiums have rose by 114%. I really want that to sink in, but it raises another question.
Question 2. Everyone knows at least one of these 3 people? Click the one that you know.
So guys, if you know at least one of these 3 people, put in the comment section, yes. Your first one is going to be somebody who already receives insurance. Your second one is going to be somebody who already receives free health care, Medicare, Medicaid, and veterans. And your third one is going to be your original entrepreneur who typically doesn't have anything at all. So if you know at least one of these 3 people, just put yes in the comment section.
Fun fact, 27.1 million Americans lacked health insurance, representing an 8.2% uninsured rate for the total population. This number has remained relatively stable, with 25.3 million people, 9.5% of the population aged 0 to 64, uninsured since 2023.
So guys, this number has actually tripled. We're looking at 91 million Americans who are uninsured and underinsured, which leads me to my next question.
Question 3, what is your number one concern when you are looking at healthcare services?
All right, so I need everybody that's watching live to participate. When you're looking at a healthcare plan, what sticks out to you the most? Is it affordability, 24/7 access to healthcare, free prescriptions, or mental health programs? I see a lot of people type in affordability. All right, so let's go with affordability, guys.
Healthcare has not been consistently considered affordable in America, with affordability being a significant challenge both before and after the passage of the Affordable Care Act, ACA, since 2010.
So check this out, guys. Before ACA, healthcare wasn't affordable. ACA was implemented, still wasn't affordable, and now it's gotten completely out of hand, which raises the next question.
Question 4. Isn't it crazy how much you have to pay out of pocket for prescriptions even when you have insurance?
So check it out. You're paying a high premium for insurance. You have to pay to use your insurance, and then you're administered a copay or deductible for that prescription. Well, here's why.
Another fun fact. Prescription prices are high due to factors like pharmaceutical company profit motives, the high cost of developing new drugs, and patent protections that limit competition. In the United States, a fragmented market with limited price controls and the influence of pharmacy benefit managers, PBMs, also contributes to higher costs compared to other countries. Question 5. Which option do you believe is the number one option for individuals when the healthcare clinic or urgent care is closed?
All right, guys. So urgent care is closed. Healthcare clinic is closed. What do you believe the number one go-to option is for individuals? I see going to the ER in the section. I see taking over-the-counter meds. So, okay, guys, we're going to go ahead and select go to ER.
Imagine healthcare that's instant, affordable, and always in your pocket. With KonnectMD, you get direct access to doctors, anytime, anywhere. Skip the waiting rooms and confusing bills. Your KonnectMD membership unlocks 24/7 virtual doctor visits, no copays, no surprise fees, prescriptions sent right to your pharmacy, coverage for your whole family, bilingual care whenever you need it. Healthcare should be simple. With KonnectMD, it finally is. Join the community of thousands who have found their way to KonnectMD. For just $3 a day, it's a no-brainer whether you have insurance or not. And the best part, for every 3 memberships we sell, we donate 1 to someone in need. Tap below to explore your options. We can't wait to be there for you.
So guys, KonnectMD is a healthcare membership that's not insurance. It provides 24/7 access to physicians, free prescriptions, and you can add up to 7 family members on the plan for no additional cost. So as you can see, we have 4 membership tiers. Our silver is only $60 a month, and that's going to give you everything I just mentioned, plus access to dental, vision, and chiropractic. Our gold plan is only $80 a month, and that's going to give you everything in the silver, plus access to a free mental health and 12 additional specialists. And then our platinum plan is only $100 a month, and that's going to give you everything in the gold and in the silver, plus access to a primary care physician, a free dermatologist, and being able to receive 2 free blood tests that's administered through Quest Diagnostics and LabCorp. And then our titanium plan is only $150 a month, and that's going to give you everything in the platinum, gold, and silver, plus access to virtual pet care, a free medical debt eraser, and then a VIP travel booking engine that gives you discounts on travel. Now, full disclaimer, guys, this is 100% telehealth, which means what? That no brick and mortar, no hospitalization, no CAT scans, no MRIs, 100% telehealth, okay? So with that being said, there are 5 services that require brick and mortar. That is going to be your dental, your vision, your chiropractic, your blood work, and if you choose to see a mental health therapist in person, you can do so. Well, here's the bigger benefit of our program.
Before we get into Q&A, let's recap on this amazing membership.
Number 1, no contracts, no commitments. Number 2, no Social Security required to enroll into this amazing program. Number 3, because this is not insurance, There is no such thing as waiting for open enrollment, which means what? When a member enrolls today, they can use the service the same day. And guys, there's no previous medical history that will get an individual denied for this amazing program. So what I'm going to do now, I am going to digress and answer any questions in the comment section that you guys may have. And as I can see them coming in, this is going to be the first question that pops up. The first one is, so can I go to the ER or urgent care with this service? Absolutely not. Remember, 100% telehealth, no hospitalization, no MRIs, no CAT scans. I want you guys to understand, we are taking care of 86% of the individuals that walk into urgent care and ER for non-chronic issues. This is why we're not here to replace insurance. We're here to help add to it, right? So absolutely no ER urgent care, guys. Next question. Can you explain how this benefits people who already have insurance? Great question. We cater to the three individuals in the marketplace. Your first one is going to be individuals who already have insurance, and that's great. Congratulations. We're happy that you can afford it. However, there's three disadvantages. Number one, you cannot access your primary care 24/7, 365. And even if you have telehealth built into your insurance, you still have to go through a network of providers and schedule a particular visit. And there's particularly a copay and a deductible that's administered. Number two, your prescriptions are going to always have a copay and a deductible attached to them. And then number three, you cannot add up to 7 people to your insurance plan without the cost going sky high. However, here's the solution. Add KonnectMD in as a supplement, and now those three disadvantages become advantages, okay? Your second group of people are going to be your individuals who receive Medicare, Medicaid, and your veterans. Well, the problem with that second group is wait times. Being able to get a scheduled appointment with their primary care right now, you're looking at a 45 to 2 month waiting period. Having KonnectMD as an add-on, we're now able to service those individuals a lot faster, a lot sooner, where you're providing accessibility and convenience for that second group. And then obviously your third group are going to be your individuals who are entrepreneurs who typically don't have anything at all. This becomes a primary for them. Next question. What are the ages to add people on the plan? Great question. Anybody that's 25 years and under can be added to your membership, and anybody that's 26 years and over has to have their own membership plan. Okay. Next question. Do the physicians write prescriptions for narcotics? Absolutely not. Okay. And I think we all know the reason why behind that. We don't have to dive into that. Okay. Next question. Is the dental, vision, and chiropractic virtual as well? Because I am confused. Well, allow me to unconfuse you. Absolutely not. Remember what I said before, guys. There are 5 services that require brick and mortar, and that is going to be your dental, your vision, your chiropractic, your blood work, and if you choose to see a mental health therapist in person, you can do so. Next question. Is there anything I have to pay outside of having my membership? Absolutely not. No copays, no deductibles. And unless that primary care physician writes a referral out and you have to physically go into a brick and mortar, then that's only when you're going to have to administer whatever outside fee. For those who have insurance, that insurance should be able to take care of that. And for those that don't, you are going to have to pay out of pocket if you have to actually walk into a brick and mortar. Because even the dental, the vision, and the chiropractic, you get up to a 60% discount. Okay. Next question. The platinum plan is cheap for all that it offers. Do you guys plan on raising the prices because this is amazing? Well, first, thank you for identifying that this is amazing. And no, we're not going to be raising the prices because, guys, this is a concierge healthcare membership. What you see is what you get. What you're paying for is what you're going to receive. So we do not plan on raising the prices of our membership. Next question. It took me 2 minutes to enroll and I saw something about virtual pet care. So are there prescriptions covered as well? No. So of course, you know, pets cost more than humans. However, you do get up to an 80% discount on pet prescriptions. Okay. So great question. Next question. Can you explain the Messenger Specialist feature? Absolutely. So guys, starting at the Gold plan, you're going to get a feature that says Messenger Specialist, where you have access to 12 additional specialists such as a alternative medicine practitioner for those that are not into the traditional medicine. We do have alternative medicine. You got sports medicine. You got women's health. So there are 12 additional specialists that you're going to have access to. And it's easy, guys. You just log into your portal, click on message a specialist, figure out which specialist that you need to message, send them that message, upload any files that you need to upload to that specialist. And within 2 hours, you're going to receive a reply back from that specialist assessing your situation and providing you with a plan of action. Okay. Next question. I think this is our last question is, why would I keep my insurance? Because this seems better. Well, listen, we want to say thank you for identifying that. And guys, we don't encourage people to drop their insurance. We're in addition to, right? And we understand this program is that amazing and we appreciate that. But it works in conjunction with your insurance, but we can't tell you what to do and what not to do. Okay. All right, guys. Well, listen, I want to thank you guys for those questions in regards to the service side of it. However, there is an opportunity side. And for those of you that are still around, we want to introduce that side to you. So let's continue. But before we do, I want to just talk about the add-ons really quickly, and I'll answer any questions in regards to that. So we do have virtual pet care as a standalone or an add-on, and that's only $19.99 a month, and that's for unlimited pets. We have a medical debt eraser. That's only $29.99 a month as a standalone or add-on, where you're able to upload your medical debt just like you would do with TurboTaxes. And then our particular referral partner will go in, negotiate those prices down between 60 to 80%, or be able to remove that medical debt entirely. Then we have a VIP travel booking engine that's only $49 a month. That's going to give you 100 room coins every month. You're going to also receive discounts on where those room coins will allow you to receive discounts on hotels. You're going to also receive discounts on resorts that's not timeshares. You're going to get 10% cash back on cruises. And then you're also going to be able to receive discounts on local entertainment. Okay. And then our GLP-1 weight loss program. I love this program because it gives you access to primary care physician, the medications, the blood work, and you're going to also receive a dietitian only for $375 a month. Okay. And then Active SOS is $129 a year. And this is where you're going to be able to, it works just like Live 360, where you're able to track your family members, up to 10 family members on that particular add-on or standalone. Okay. So that is our add-ons. Now let's move into our next section, which is the opportunity side. Let's go.
Are you ready to make a difference and get paid for it? Join the fastest growing virtual healthcare agency in the country, KonnectMD. With KonnectMD, you can help millions of Americans access affordable 24/7 healthcare while building a business that pays you every single month. Earn a $35 bonus for every membership sale, plus 25% monthly residual income, starting with your very first sale. And as your team grows, unlock up to 5% in agency overrides, special bonuses, and even company-paid trips. No experience, no problem. We provide all the training, certifications, and tech support you need. Track your sales and commissions with our business CRM and enjoy nationwide rights to sell. Be part of a movement that's changing lives, saving families money, and rewarding you for your impact. Whether you want extra income or to build a legacy, KonnectMD is your opportunity to shine. Ready to get started? Join KonnectMD today for only $24.99 a month and share the solution. Build your income and become a healthcare hero.
So, ladies and gentlemen, what I would like to call this is the business in the box with benefits, right? So you're not going to find anywhere to start a business for these extremely affordable prices to get started. So guys, to set up your agency, these are your one-time fees that you're looking at. And what does that consist of? One-time $29 enrollment fee, $24.99 monthly back office fee, and then whichever membership you decide to attach to your agency. Okay. So $114.97, $134.97, $154.97, and $204.97 are one-time prices. And then month after month, the only thing that you're responsible for is your $24.99 back office, and then whatever membership that you attach to your agency. Once your agency is set up, you are now in position to receive the 3 amazing benefits. The first one is, because this is not insurance, you do not need a license to push this amazing service out to the masses. Number 2, guess what? No chargebacks, which means that if a member enrolls this month and cancels next month, no harm, no foul to the member, no harm, no foul to your agency. And then number 3, you are going to receive a full CRM system that's going to track all your sales for you. You're going to also receive a marketing university that's going to give you all the marketing tools to market, advertise, and promote to businesses, and then market, advertise, and promote to consumers. And then you're going to receive a data access to where you're able to log in, put a zip code in, and it'll pull up all the companies that will give you the opportunity to reach out to for these amazing services. Now, agency is set up. You're going to now put yourself in a financial position to earn a $35 bonus from your very first sale up front, no matter what membership somebody enrolls in, and that's per member. And then monthly, passively, month after month, you're going to get paid 25% of that membership that individual takes advantage of. So in this illustration, if you have enrolled 500 members into your agency, that's going to be a $17,500 bonus that's paid up front. Bonuses are paid weekly. And then month after month, before the 15th of the following month, you're going to get paid $7,000, $10,000, $12,000, or $18,000, depending on which membership they enrolled in month after month. So guys, this is the beautiful part about you building your own agency. However, if you decide that you want to leverage your agency, you can do so. And when you do that, here's the number one thing that we love. You do not have to worry about the MLM model of we do not get paid to recruit people. So you have no worries of our foundation ever crumbling because we have a solid foundation, right? With that being said, however, you do make a percentage off whatever agents you bring on board under your agency. So your level 1 agents, you're going to make 5% of the book of business that they write month after month. Your level 2 agents, you're going to make 3% of the book of business that they write month after month. Your level 3 agents, you're going to make 2% of the book of business that they write month after month. And levels 4 through 10, you're going to make 1% of the book of business that they write month after month. So as you guys can see, you have the opportunity to build what we like to call true residual book of business, because I guarantee you that when a member uses the service, they'll never lose the service. So guys, we want to thank you for your time. We appreciate you guys tremendously. Do me a favor. You're going to want to get back with the individual that invited you to this particular live, and here's the reason why.
Thank you for hanging in there until the end. You are one of these 3 people.
You are either number 1, Dr. Pitts, I love this program. I just want to be a member only. Let me get signed up for a membership that fits me and my family. And to that, we say thank you and welcome to the family. Or you're number 2. You say, Dr. Pitts, I want the business in the box with benefits. I want to be a part of this movement. I want to make some money at the same time, and I want to help a ton of people. And to that, we say thank you and also welcome to the family. Or you're number 3. You say, I'm not interested at all. And guess what? That's okay, because we will always be here. We're not going anywhere. And to that, we say at least refer people that you know that can benefit from this service, because we are truly appreciated. And we know you'll be back soon, sooner than later. Other than that, if I can leave you guys with anything, allow me to leave you with this. Coming together is the beginning. Sticking together is progress. But us working together, that is what success look like. Get back with the individual that invited you on this call, this live today, guys. And we just want to say thank you for your time. And I look forward to seeing you at the top. Peace.